Welcome to the OraQuick HIV self-test instructional video. It is important to follow the instructions for use to ensure an accurate result. The results are confidential. For any questions during the test, contact our U.S. Support Center toll-free at 1-866-436-6527. Before you start, a few things to keep in mind. If you are using this test earlier than 3 months since a risk event, it may not produce an accurate result. This test should not be used to make decisions on behavior that may put you at increased risk for HIV. If you are on antiretroviral drugs, including for HIV treatment, pre-exposure prophylaxis, or post-exposure prophylaxis, you may get a false result. If you have participated in an HIV vaccine clinical trial, you may get a positive result using this test, but it may not mean that you are infected with HIV. You should seek follow-up with the research group. If you are unsure about your next steps, regardless of your test result, please seek advice from a medical professional. Do not eat, drink, or use oral care products such as mouthwash, toothpaste, or whitening strips 30 minutes before starting this test. Also, remove dental products such as dentures or any other products that cover your gums. Let's begin by opening the box. Inside the box, you will find the instructions for use, an HIV Testing in Me booklet, a test pouch, and a stand. Read the HIV Testing in Me booklet and the instructions for use thoroughly before proceeding. The test pouch contains a single-use test stick and a test tube. First, open the test pouch and remove the test tube. Then, carefully remove the cap from the tube by gently rocking back and forth. Be careful not to spill the liquid in the test tube. Then, place the test tube in the stand. Next, open the test pouch and remove the test stick. Do not touch the flat pad portion of the test stick. A desiccant pack is included inside the inner test pouch and should be discarded. Now, swab the flat pad of the test stick along the upper gum. Then, swab the flat pad of the test stick along the lower gum. Make sure you swipe each gum only once. Do not swab the roof of the mouth or the inside of the cheek or tongue. Both sides of the flat pad may be used during this procedure. After swabbing, put the flat pad into the test tube until it touches the bottom. The result window on the test stick should be facing towards you. At this point, start the timer for 20 minutes. Do not remove the test stick from the test tube. Pink fluid may appear in the result window. This will gradually disappear as the test develops. In a well-lit area, read the results after 20 minutes, but not later than 40 minutes. If the result is negative, you will see one line next to the C and no line next to the T. If you have been potentially exposed to HIV, it is important to test again in 3 months. The result is positive if a line appears next to the C and a line appears next to the T. Even if the lines are very faint in appearance, the result is positive. If you read a positive result, do not panic and know there is a lot of support available to you. To confirm the result and for guidance about next steps, visit your healthcare provider or nearest healthcare clinic. If you are not sure where to go, call our U.S. Support Center at 1-866-436-6527. All calls are confidential. A test result is invalid if no line appears next to C. A red background in the result window makes it difficult to read the result. any partial lines appear next to the C or the T, or no lines appear anywhere inside the result window. Once the result is read, remove the test stick, recap the tube, and place all contents in the regular trash. If you are unsure of your result or what to do next, call our U.S. Support Center at 1-866-436-6527 anytime 24 hours a day, 7 days a week.